Hello, representatives of the Healthcare Committee. I'm Lindsay. This is Jennifer and Paula, and we're here to propose a policy change to an existing bill regarding nurse staffing. And here's Jennifer to start it off.
Okay, so did you know that unsafe staffing can result in poor quality of patient care? So with this, there's an increased safety risk for both the patient as well as the nurse. There's also higher risk for medical errors as well as an increase in nurse burnout. Carlson 2017 reports that in 2014 alone, it was found that 1 out of 5 nurses, new nurses that end up leaving the profession during the first year of practice. Having safe practice ratios leads to a compromise in care, which means that the nurse is not able to provide the patient with adequate comfort and support as she is more pressed for time. Education and family support are also lacking, which could ultimately lead to readmission and/or non-compliance. With this, unsafe staffing issues can have detrimental effect on nurses and create a higher level of stress. This leads to burnout and compromises the safety of all the patients. So we have background research, evidence, and data. So typically in hospitals, they have a set nurse to patient ratio depending on the policy of the hospital. For example, med-surg floors, they can see up to 6 patients, and in some units, there's 7 patients. While ICU or intermediate level care or step-down units can either be 1 to 2 or 1 to 4. Evidence suggests that the higher the patient-nurse ratio, the greater the risk of increasing burnout, fatigue, as well as exhaustion. Statistics and data both show that when the patient load is increased, the risk for both medical errors and patient safety are greater, giving higher quality care to patients are not feasible because time spent with each patient is also limited. The Department of Professional Employees of 2019 reports that each patient that a nurse has over 4 increases the risk of emotional exhaustion and fatigue, as well as burnout, by up to 23%, and decreases job satisfaction by 7%. So the policy that we chose is the Safe Staffing for Nurse and Patient Safety Act of 2018. This policy was enacted into Congress on February 15th, and it was created to help alleviate safety issues and concerns with understaffing. So this would be supporting the nurses by lowering the patient ratios. In doing so, this bill would help greater overall care given to patients by allowing a lower patient load, which would help increase the quality and quantity of care given to each patient. Lower patient ratios would help to decrease medical and medication errors, of which both could have detrimental effects and lead to increased mortality rates. It would also help to decrease nurse burnout, emotional fatigue, as well as increase patient safety. The overall benefit of this act could implement into hospitals would create the ideal environment for helping and healing the patients with the appropriate care and time spent with everyone. So next, let's talk about the proposed policy change.
So mandated ratios fit all hospitals' needs across the board. So to be more universal, we propose that hospitals maybe be more flexible with their staffing and allocate their resources more effectively to ensure safer nurse-to-patient ratios. This allows more authority to each hospital as to how they want their staff to spread out according to various factors. This can be census, acuity of patients, nurse call-outs, and many others. So why is it important to move this change, and what are its advantages? Patient safety, quality care, patient outcomes, patient satisfaction, nurse retention, hospital reimbursement, readmissions, and length of stay. Patient safety is key in the nursing profession. Non-maleficence is something we learn in nursing school. It's drilled into us. We do no harm to our patients, so we want to make sure that we're able to do that. Quality care, outcomes, and safety are directly related to quality nursing care. So we want to make sure that we are giving our patients the best quality of care that we can, and we can do that with better ratios. Patient satisfaction, we want to make sure that our patients are satisfied with the care that they're receiving. So if we can spend more time with them in order to educate them and provide care, then they'll be more satisfied. Also, nurses can get burnt out with high patient ratios. So if we can lower that, our nurses will be more happy and we'll be able to retain them, which will save the hospital money. Hospital reimbursement, HCAHPS. They have a lot of questions on there related to nursing, and the HCAHPS survey directly affect reimbursement from Medicare. So this is a big thing that we can change by lowering the patient ratios. We'll get better scores because we'll be able to take better care of our patients. Readmissions, in a study relating to staffing and 30-day readmissions of heart failure patients, it was found that there was a 60% higher mortality rate in hospitals with inadequate staffing. When overworked, nurses may not be able to provide the best possible care. It's not for lack of trying, they just can't be stretched that far. So also length of stay. If we can better care for our patients, then we can provide the care in a shorter amount of time and get them well and get them out of the hospital. Disadvantages. There are disadvantages to everything. Not having adequate staffing, because of it being flexible staffing. If we don't have enough staff, then we might have to get temp nurses or travel nurses, and that comes at a very, very high cost. Also, with staffing, nurses may be placed in areas that they're not comfortable or if they've never been before. Seasoned nurses, it might be a little better for if they're kind of used to the hospital system and patient care and everything, but new nurses might have a harder time acclimating. Moving on, if we do not implement this change, this policy change, hospitals will continue to have high nurse to patient ratios, and that will result in safety concerns for patients. It can also result in litigations, which can cost the nurse and the hospital millions and millions of dollars. But aside from any legal action, the true concern is that of the patient, because as nurses, we are there solely to improve the health and well-being of the patient. So if harm ensues, we have not fully done our job, and that just proves low quality of care. So we want to implement this to change that. Also, nurse burnout, it's a real thing, especially when unsafe patient assignments are given and nurses are trying to keep up with the many demands that they have. So the average cost of nurse turnover is $40,000 to $64,000, and that results in a hospital loss of $5.7 million. So if we don't address the staffing issue, hospitals will continue to be negatively affected. Implementing the change, if this change gets pushed through, then it will just have positive effects on our patients, which is our sole concern. And that is what makes this change stand out from other policies regarding nurse staffing. Studies show that there is a correlation between inadequate nurse staffing, poor nurse working conditions, and poor patient outcomes. For every increase of one nurse, patients have a 14% decrease in mortality risk. Safe staffing levels will reduce the risk for errors, since nurses will be able to spread their time over patients. They'll be able to make safer choices for their patients and better care for them overall. Nurses will be less burnout, which will help to improve staff morale and allow nurses to enjoy their work. Ultimately, the patient is the one who will benefit from all of these changes that I've spoken about. So now on to the policy change.
So to give you an idea of numbers, Massachusetts trying to implement a similar change as California, who was the first state to mandate nurse to patient ratios. Massachusetts did estimate an annual cost of $676 million to $949 million. So it does put a financial burden to hospitals. However, studies do show that reducing nurse to patient ratios improve patient outcomes and turns out to be more cost effective for the organization. So the results establish that the higher the ratios, the lower the cost, but it yield to more or higher mortality rates. The American Nurse Association supports the bill of the Safe Staffing for Nurse and Patient Safety Act of 2018. It shows that it can yield savings by adding staffing of nearly $3 billion by avoiding extra hospital stays for adverse effects. So now, is this feasible to do now and for the future? So we have established that mandated nurse-to-patient ratios may not be the answer to alleviate our problems, but it may be the foundation to improve patient safety as well as nurse satisfaction, and which in turn increases quality of care. There are a lot of factors to consider. Of course, the size of the hospital, the availability of beds, the amount of people that are seen. So that's why our proposal is to allocate resources better. As far as evaluating the change, there is a way to evaluate the change. You can do it through data collection from quality control, from hospital budgets, from unit budgets. You can also use hospital-specific or even unit-specific surveys to patients as well as staff. So you can determine the efficiency of the change by asking your healthcare team if they like the change, how they're reacting. You can use a physician standpoint to find out if the orders are being executed faster, if the response time reflects improvement. Also, cost. You can evaluate the cost. Is the change affecting reimbursement? Are the hospitals making up for the losses by decreasing readmissions and increasing staff satisfaction, nurse retention, length of stay? Are patients being able to go home sooner? So affecting that by increasing, again, nurses on the floors. Decreasing in errors. Are the nurses being more vigilant just because they're not being stretched out so thin? Are they catching errors or not doing them? Patient satisfaction. How are the patients feeling? Are they feeling more in contact with the nurse? Do they feel better informed? Are their expectations being met faster? How about nurse satisfaction? Are nurses feeling like they're practicing in a safer environment? Do they feel the support of their organization? Are nurses able to better prioritize their care and provide better quality of care because, again, they're not stretched out so thin? Nurse retention. Can this mandate decrease nurse burnout? Are nurses looking for employment elsewhere? So as far as our policy supporters, we currently do have 2 national bills set to appear one before the Senate and one before the House of Representatives. The Senate is Ohio's Democratic Senator Sherrod Brown, and the House of Representatives is Illinois Democratic Congresswoman Representative Janice Schkowsky. They both are very focused on patient safety and by decreasing those ratios. Now, who will we need to recruit and why? We strongly believe that we need to recruit physician groups. We think that the collaborative, being able to work with the physicians and having their support can make this change a little bit easier and implementing this change a little bit smoother. We are aware that we need to recruit the hospital industry. The hospitals keep pushing back for this change. They say that there is not enough research to support increasing staff, that there is not enough nurses to begin with to hire. So that could cause some of the hospitals to close. They also think that it would jeopardize the care by diverting money from other critical resources, causing more strain on the financial situations of some hospitals. We want to also bring in the American Hospital Association and the American Organization of Nursing Executives, who argue that mandatory ratios can make scheduling and staffing more rigid and create unmanageable costs and higher costs of care. We, of course, would like to get the support of additional co-sponsors for the bills because there's strength in numbers. And we want to get the support of the public. The public are our patients, so they should be aware of the safety issue and why we want to make this change happen.
Okay, so in summary, as nurses, it is very imperative that we continue to fight for decreased patient ratios. We must fix the issues at hand in order to increase the patient quality care and safety. We must continue to voice our concerns and allow patients the right to receive the care they deserve. The Safe Staffing for Nurse and Patient Safety Act of 2018 advancement policy will allow for a more flexible staffing schedule to ensure that nurses are not experiencing emotional fatigue, burnout, and decreased job satisfaction. In return, nurses can offer patients a higher level of care with more focus on education and overall well-being. The cost of change may be worrisome. However, our proposed change to better allocate resources may improve healthcare for all involved. Thank you for your time.